Hi there, welcome back to another episode of Real Talk with Dr. Jim Sharps. Great conversation we have, just looking at original medicine and the natural perspective on a broad range of topics. Really the goal we have with this series is to demystify natural medicine a little bit. We know there's a lot of information available online, and what we really try to do with actually all the content on this channel is demystify it, make it simple, and really empower you as a viewer, as a finder of this channel and these videos, to really be more empowered and more informed about decisions on your own health. So as you'll know, if you've been following along, we've been doing a series, The Philosophy of Original Medicine, really setting out the stall of original medicine so people that perhaps haven't heard of it before can kind of be aware of really what is it, what it's about, and how it can impact. We've really looked at the broad philosophy. We've looked at some Dr. Jimisms, as we like to call it. Make sure you do check out those videos, looking at a humorous lens, looking at original medicine and comparing it with more traditional and traditional forms of medicine. And what we're going to do now is really turn to the more practical side. We're conscious that we've talked in kind of theories and analogies a lot. What we want to do is make it super practical, really looking at where it is and where, if you're watching this video and you have health challenges or you know people with health challenges, you can listen to the videos and be like, oh, okay, it can start to connect with kind of practical everyday life. So we'll cover that. That's probably going to take the next few weeks. We don't want to rush through it. We want to give just about enough that you can digest it in one video. So that's really an outline of where we're at. Dr. Jim, again, as always, thank you so much for taking the time to share with us. So what we'll cover off today, if you don't mind, Dr. Jim, is, and I know it's you've covered it before, there's other videos that you have shared on the channel that reference that the 10 underlying causes of disease. And I know this is something that people may not be aware of. From the top of my head, knowing from what I've heard from you before, I know there's infection, inflammation, malignancy, toxicity, trauma, genetic, psychiatric, and then there's about 2 or 3, I think about 3 more that I always forget. Could you finish off that list of 10 for me?
Yes, the final 3 are iatrogenic, nosocomial, and idiosyncratic. They don't come off the tongue real easy. The other ones most people are familiar with. And just to put it in context, these are not defined by natural medicine. These are medical terminology for what these 10 underlying causes are. There's a course that they take called the text that they use is the Gamo's Diagnostics. So in that book of diagnostics, they group all those different diseases and all those different issues as being the result of one or a combination of these 10 underlying factors for all diseases.
Wonderful. And in terms of, thank you for clarifying that. In terms of how original medicine takes those underlying causes as outlined in traditional medicine, what does original medicine take of those 10 factors? How does it view them, and how does that compare with traditional medicine?
Right. Well, as you know, original medicine is the 8 laws of health. So essentially what we do is we say, well, let's take their model, let's take their definition of what disease is, because in original medicine, the definition of disease is very different. But in this particular case, we said, let's take their terms. So let's take these 10 underlying causes and let's look at what the medical or conventional protocol or approach is. And then let's look at how original medicine would deal with it. So using their own terminology, basically showing the difference between the medical approach to dealing with these 10 underlying factors versus the original medicine approach for dealing with these 10 underlying factors. So that's essentially why we do that. We didn't want to come up with any new approach, new terminology, but using their terminology and basically demonstrating the difference in approaches for the two.
Yeah, That makes total sense. So what we'll do is we'll run through them at a very brief level,
Okay.
as Dr. Jim mentioned, just kind of giving a overview of what it is. Most of them, I think, are fairly self-explanatory, but it always pays not to assume. So, Dr. Jim, I'll just ask you very quickly just to run through them. We will save the in-depth analysis and discussion of each of the 10 factors for later videos. But really this video is just an overview so people are aware of, that particular framework and how original medicine compares. So we'll start perhaps with infection. Tell us more about infection as an underlying cause of disease and where you might notice it in your daily life.
Oh yes, and most people are familiar with this. You cut your hand, you cut your finger, or even internally, if there's an overaccumulation of some kind of bacterial or viral issue, then it becomes infected. And so people understand what that is, and that's simply what it is. You have an accumulation of infection either externally or internally in the body, which of course then can manifest itself in a whole host of named diseases.
Okay. And in terms of those diseases, Dr. Jim, what are a couple that, again, I'm just trying to speak to people that I'm assuming that not everything is known, and just keep it super basic. There may be younger people watching. What are some of those well-known infections that people would recognize in daily life?
Okay, well, one example that immediately comes to mind is UTI. And in the word, it's urinary tract infection. Men can get it, women can get it, and it's infection. It's an infection somewhere along the kidney, bladder, urinary tract. So that's an example. You can have it in the lungs, and then and of course that manifests itself in a whole host of respiratory issues. Pneumonia, tuberculosis, even COVID, colds, flus. It's an infection. It's a viral infection in the case of many respiratory diseases. Sometimes it's a bacterial infection. So all of those different areas of different organs or different tissues that, as I said, they manifest itself in named diseases, and they can literally, you asked for two or three, there's literally can be hundreds of them. And sometimes it's after the person who discovered it is Pyre's patch or some other person, but it's all these named diseases, but it's all a result of some kind of viral or bacterial infection.
Okay, wonderful. Thank you. And moving on, inflammation. Tell us more about that. I think people know generally the term inflammation, but maybe you could just go over it again for those that maybe aren't aware.
Yeah, this is another one that many people are familiar with, but inflammation is inflamed. There's a lot of heat, there's a lot of swelling, and that's essentially what it means. And again, that inflammation can be external. You have an infection, and you can have inflammation as well, where it swells up. You can have that swelling internally also. And it can be minor swelling to major swelling. And then again, there's a whole host of named diseases that they come up with, but the essential thing that they are dealing with is inflammation and trying to reduce that inflammation.
Yep. And again, Dr. Jim, what would some examples be of perhaps some conditions that are well known where inflammation is that kind of underlying cause?
Well, you can have pleurisy, you can have a whole host of digestive issues where there's bloating and diverticulosis can be swelling of the intestinal lining. So usually, as I said, that they based on the organ or the tissue, they come up with a name that pretty much pinpoints the organ or tissue that is inflamed, and but the remedy is basically dealing with the inflammation, and irregardless a lot of times of what the disease name is or where it's located. But there are a whole host of disease names that that have inflammation as one of the underlying factors that is contributing to its manifestation.
Yeah, and would arthritis be classified under the inflammation grouping?
Yeah. Rheumatoid arthritis, any of that. Like I talk about diverticulitis, and it's a very good question, because a lot of times it does end in itis, and that itis is a good indication there's some inflammation going on somewhere associated with that particular itis. So that's a very good one. And arthritis is a swelling in the joints where the arthro material is. So you have swelling in the joints, the knees, ankles, and it's that inflammation of the bone structure or the joint structure, the ligaments. So it can be muscle, but that's a very good example of one of the inflammatory issues that are the result of naming isolating the particular area that's being inflamed.
Clear. Thanks for that. So we've gone through infection, we've gone through inflammation. The third one on the list, Dr. Jim, malignancy. Tell us more about that.
Yes, that's the big bugaboo, and that's cancer, basically malignant. There is so much deterioration of the particular area that it becomes malignant, it becomes cancerous, it develops a system of its own, and that's where you get the tumors and all of that. But and that's a good summation of the first two, because now there's usually some form of infection that occurs. It happens over a long period of time that the immune system isn't handling. There's inflammation, and that inflammation manifests itself a lot of times as cysts and tumors. And so, and that malignancy is that issue where the immune system is starting to become so compromised that it's spreading out first locally, and then as it progresses through the various stages. You've heard of stage 1, stage 2, stage 3, stage 4. It's growing, and then it's also spilling out into the system and affecting other areas of the body as well. So that's what malignancy generally refers to, but most people think of as cancer.
Okay, that's clear. The fourth kind of underlying cause I have here is toxicity. Tell us more about that.
Yeah, toxicity is some kind of toxin, some kind of poison. It could be known chemical poisons like arsenic. It could be mercury. It could be DDT, but it's poisons that the body has to deal with. So the body can deal with small amounts of poisons, but if you're getting a daily dose of poisons, either in your food or in your drink or even in the air, again, the body is designed to handle a certain amount of toxins. But once it gets to a certain threshold, then it becomes problematic. And then again, you get a whole host of named diseases as a result of that toxicity.
Yeah, I think that makes perfect sense. The next one, so the underlying cause 5 I have here is trauma. I think that's probably going to be a very well-known term to most people watching this video, but perhaps again, if you could just give us an outline for those that perhaps aren't aware.
Yeah, and trauma is where it comes to a point where there is a major episode. The previous 4 basically are what are called chronic kinds of issues, where it can develop slowly. When you talk about trauma, it's all of a sudden. When you get hit by a Mack truck, that's trauma. When you fall and you bang your head, that's acute, it's immediate, and it is major. So it's a major event that's occurring to some part of the body. If you are working and with a saw and you saw off a finger, that's trauma. So it's more immediate. It's a concentrated period of time. It's not happening over a long period of time. Now you can have chronic issues that are developing over a long enough period of time where all of a sudden you get a traumatic event. So if you have long-term infection, for example, the trauma can result in your that finger being so infected, so inflamed that there's so much pain and trauma that it can actually fall off. That's traumatic. So that is a really important one. And quite frankly, from a natural standpoint, we acknowledge that Western medicine has the best system and is best designed for handling those types of events.
Yeah, that's a very good point you bring out. Because from other videos, I would encourage everybody to check out the other videos in the channel. You said many times before that what original medicine is great at dealing with is those issues that build over a long period of time, and can really address those through following the 8 laws of health. So it's a great point you bring out there again. Moving on to the next one, I have genetic here. Again, something that would be familiar to most. But again, if you could give us a definition and some examples, Dr. Jim, so as we go more in depth in future videos, we have a good point of reference.
Yes, and that's a very important one. And yes, we'll elaborate on it at another time. But genetic is basically saying it's based on something that's been passed down from your ancestors. So that's an interesting one that we will pursue. Is there really a genetic predisposition at all? But nonetheless, again, these aren't our terms. These are the terms that they use in medical school when they look at trying to identify, diagnose various diseases. So a lot of diseases from a medical standpoint are genetic. And anticipating your question, what are some examples? They say, well, the cancer is genetic. It's been passed down. A predisposition towards Hodgkin's disease, or a whole host of named diseases. They are basically classified as genetic, as being passed down, which essentially is saying that the person itself, him or herself, is not responsible or doesn't have a role in its manifestation. So that's an interesting one, that we see if in fact many of these diseases are genetic, as is so called, and what and just to kind of make a slight point on it, from a natural standpoint, if things are genetic, these diseases are genetic, when did they start? We've been around for thousands of years. And the question you might want to just ponder is, if diseases are genetic, when should be the time when we should be extinct as a species? Because most of us haven't created ourselves. We've been around for many generations. So just think about that, and we can discuss further some of these genetic diseases and see if in fact, or what role there is a role. There is a role, but how much of a role does genetics really play in a lot of the named diseases that we deal with?
And for those of you that are following along in the series, we've already given a teaser in the Dr. Jimisms. I'd encourage you to check out that video. And the Jimism there, if you'll remember, is genetics loads the gun, lifestyle pulls the trigger. So anyway, that's just a bit of a spoiler alert for people who've been following along, and not bringing out the Jimisms wherever we can. Thank you for that. The next one on the list is psychiatric. That's something that I think a lot of people will be again aware of, but if you could give us a framing definition so we know as we move forward with the rest of the series what we're talking about.
Yes, that's another one of those really interesting ones, and that basically says diseases that are the cause or the factor contributing to it is in the mind. It's mental or emotional. It's not one of those tangible things that you can see in a microscope or read in a machine, but they're basically mental, physical, not so much physical, but mental, spiritual. So that's that whole area of diseases. And you know the kind of things we're talking about there. We're talking about depression, anxiety, manic depression, schizophrenic. There's a whole host of these so-called psychiatric disorders that basically you can't measure with a piece of equipment or in a blood test, but according to, again, these 10 categories of underlying factors, it's those category of diseases that fit under this psychiatric underlying factor, if you will.
Yeah, that's very clear. So we'll come to the three that stand out the most in terms of name, but perhaps in terms of definition are some of the least remembered. So we'll go over the first one, Irogenic. If you could outline, there may be some people that so far they've yep, I know all of those factors, and they get to Irogenic and it's just been silence. So if you could just enlighten us a little bit, Dr. Jim.
Yeah, and you don't hear a whole lot about these, to be very honest. It's kind of interesting when I read some of the reports that my clients bring in, and they do mention it a couple of times, a handful of times. But iatrogenic is a nice fancy term that's saying that it's related to illnesses caused by medical examination or treatment. So they're medically induced. And interestingly enough, many they're basically, you never hear of naturogenic diseases, if you will, to make the comparison. Diseases that are caused by natural phenomena. But iatrogenic is a term of many issues that are caused by medical treatments, by medical examinations. Some of these things can cause trauma, if you will, but it's medically induced, and not because it's intentional, but they go to school for all these years for a reason, to try to be able to manage the treatments, etc., because they can be very very problematic. So that's what iatrogenic is, and there are over a couple of million severe adverse reactions from various examinations and medical procedures. So that's another whole area that is very interesting, but obviously is not going to be advertised by the medical infrastructure. But it is studied, and they do talk about it in school. Remember, I said this is what medical students go through, understanding the diagnostics. So somebody comes in with an issue, what that means is what is the cause or factor that brought about the manifestation of it. And so they came. This is a new term. This didn't exist before the 1900s. This iatrogenic, not as much. So anyway, we can have a lot of interesting conversation about that whole topic when we come to it. But that's what it means. It means medically induced. Nosocomial is another interesting one, fancy sounding, etc. But basically, the bottom line is it's a disease caused by being in the hospital. So disease originating in the hospital. So you've heard of people going in for one thing, and then they come out with other problems, or they develop other problems. And so it's from a disease originating in a hospital. And I have a lot of fun with this one because basically, when it comes, for example, to the germ theory, you've heard me say in the past, if you really believe that germs cause disease, why would you go to a hospital for anything? You have more variety of diseases and germs in hospitals. That's where sick people go. So nosocomial, and the good news is it's not necessarily that big a problem, but there is a category, again, that they learn about of here's the kind of issues or the kinds of diseases that are caused by only when you're hospitalized. Or generally speaking, you see it in hospitalized patients. And then the last one is my favorite, idiosyncratic. And it's a real word.
Yeah.
If you look it up in the dictionary, it means unknown cause. So, and you've heard of people going in, I have a headache, I have this, that. We don't know what's causing it. We're going to give you this to make it go away, this aspirin, in the case of a headache, or there are a number of things. And to be fair, even in the natural world, the naturopathic world, if you will, there are some things that you come to that it's not very clear what the cause is, but that's what it means. And so that's another one of the things that I address in my presentation when I talk about here is the medical approach and here is the original medicine approach. So there is no, even though it's unknown what the cause or key contributing factors are, there is a medical approach, a conventional approach for dealing with that person, that issue, and there is a natural or original medicine approach. And so that's, as you indicated, we can discuss that a little bit further when we go into the different approaches that are taken with those 10 underlying factors.
Wonderful. Dr. Jim, thank you as always. It's really a pleasure just to go through these things with you. So do keep staying with us in this journey as we keep going through the philosophy of original medicine. We're really turning to a much more practical footing now as we go through the videos. So do follow along with us. We'll include any links that are useful in the video description. If you do appreciate these videos, we just ask, do give us a like and subscribe to the channel. We do put out a lot of different content on different themes, so do follow along with us there. I hope you've enjoyed this video, and we'll see you again soon. Bye for now.
Bye for now.